The South End Community Health Center will try to help more people survive or prevent cancer thanks to foundations connected with the NFL and the owners of the New England Patriots. To tell us about the crucial Catch Intercept Cancer program are the health center's Quality and Population Health Manager, Subi Mukherjee, and from the American Cancer Society, the Health Systems Manager for Primary Care Systems, Corey Hoffman. Thank you both very much for being with us. I want to start with Corey. What about the overall picture here, the importance of early detection?
Well, it really does mean there are a lot more treatment options. And so if someone is diagnosed with cancer, the opportunity to be treated and then survive and have a high quality of life after cancer is much greater with early detection. So having access to early screening and early detection is critical.
So I imagine this is focusing mainly on breast cancer, colorectal cancer, but what's your experience working with the clientele at the health center in these areas?
Well, Chris, the South End Community Health Center has been serving the community for more than 50 years now, and through that time, the population has changed, but the need for essential primary care has always been the same. And so for us, it's really important that we not only connect patients to primary care, but make sure that we get them those early cancer tests when they need them.
And Corey, I know that if you say breast cancer, for example, if you look racially in terms of the incidence of the cancer, there's not much of a big difference, but in terms of the people who survive, it's an enormous difference, isn't there?
Right, there are a lot of differences, and one of the most notable differences is between Caucasian and African American or Black women. The mortality rate for Black women is much higher, and that's part of our objective with the grant, is really to shrink that gap. In Massachusetts, actually, we're doing much better. That gap is smaller, but it's persistent. So we want to ensure that all women have access and have sort of the extra level of support and outreach that the health center provides.
So you're going to be doing some outreach around this too. So what are you going to be telling people in the community exactly?
Well, I think one thing we're going to be doing is making sure that our internal systems for identifying patients who are due for a screening, that we make sure that we get them 100% of the time. And then once we do have them in front of us, we want to make sure that they have all of the facts and options available to them. We want to know that they understand what the procedure actually is going to mean for them, and that they know that we are there to support them through the whole process. Because when you're talking about disparities, for many of us, it may be easy. If you have a mammogram scheduled, you go to the mammogram, you get the result, and it's finished. But for the communities that we're serving, they may have very few social supports, they may have housing insecurity, they may have transport issues. So the actual getting to the appointment is a long journey into itself. So,
Corey, I know you also got to let people know, depending on their age or maybe family history, some people need screenings more or sooner than others, don't they?
Right. That's a really important conversation for women to have with their physician. And we're, if we're talking about mammography, women want to have a conversation with their physician around the age of 40. The American Cancer Society recommends beginning that conversation at 40 and then annual mammograms starting at 45 until age 54, and then every other year after that. So it's important to know the family history and other risk factors to determine if that schedule is appropriate.
This has been in the news, and we're talking with Subi Mukherjee from the South End Community Health Center and Corey Hoffman from the American Cancer Society. Subi, I guess you want to be here telling people that this is not a burden to come in and get screened, either financially or in terms of scheduling. So what are you going to do to make that work for people?
I think once we're going to talk to them about it, we're going to ask them about their barriers, first of all. And then once they identify potential barriers, we're going to think through how we can support them through them. So if they say that they have an issue with transport, we're going to connect with the hospital where they're getting the procedure and say, what can we do together to make sure that this patient gets there on time, and that if they have a colonoscopy, that they can get home safely too.
Of course, if you're screening for colorectal cancer, people think of that procedure, which can actually cost thousands of dollars if you don't have insurance. But what about ways to make it easy for people? Isn't there a portable test, for example?
Yes. Very recently, there has been great science. We have something called the FIT test, and you can actually take this test home And using 3 different samples, you can basically swab them, put them in this envelope, and take it back to your health center. And they found for people who don't have a family history of colorectal cancer that this is just as sensitive and a great way for us to detect.
Corey, what about the importance of screening campaigns to not only address cancer, but get people more engaged with their healthcare? Isn't that important too?
It's very important, and I think, again, another objective of this grant is to help patients get connected with primary care and have a medical home where they feel comfortable being treated. They can not only have appropriate tests for cancer, but also they can speak with their physician and healthcare team about changes they can make to their lifestyle. So, not smoking, using alcohol or at an appropriate sort of level, all the things that they can do to lead a healthy life. Including, I think there's a lot of innovations in terms of diet and, the access for fresh produce. That's one of the things that the health center
we have
is
the
great
fresh
at.
truck, so we actually bring fresh produce there, and then we also have wellness groups that patients can come and participate in and have that group support.
And you might have some people coming in who've never been to a health center before. What's that like?
I think that's a very good question. I think in a place like Boston, where we have so much access, where there are many health centers, people may think that it's okay.
Things that they can get.
Well, they think that it's okay. Like, it's good. I can go to this health center today and another one tomorrow. But I think the idea of a medical home where we can really provide wraparound services for your primary care, and say that we are there to develop a relationship with you and know you as a person so that we can provide you the best care. I think it's that dialogue. It's a lot about that's what primary care is going to. It's not just about delivering the service and checking the box. It's really about getting to know you.
Well, if people want some more information about the campaign, or if they want to call about maybe getting a screening of some kind, what's the best way for them to do that?
Yeah, we welcome anyone who wants to get access to primary care or wants to learn more about screenings. They should call our phone number, 617-425-2000.
Thank you both very much, Subi Mukherjee, and also with us is Corey Hoffman. Thank you very much.